Hi guys, welcome back to my channel, Life of a Caribbean Nurse. It's your Nurse Ray, and today I'm here to just give you some small tips, on the importance of speaking to your elderlies or the persons in your family, the seniors in your family, to find out things like, conditions that affect them, whether it be diabetes, whether it be high blood pressure, whether it be that they've found that there's a lot of individuals in your family that have cancer, have asthma, have sickle cell disease, have mental health issues, and the list goes on. Most time when we know the condition that they are affected by from an early stage, we are able to better prevent ourselves or other individuals in our family from actually going to a state where it might actually kill them, right? For example, if you know that there are individuals in your family that are affected by high blood pressure, dietary practices and management would be better or should be better, so you know that you will basically do frequent check on your blood pressure level. You will be doing check on your blood itself. You'll be monitoring your diet. You'll be practicing exercises so as to prevent this condition from becoming chronic on you or becoming so bad that it might even reach a state where it give you a stroke, as we call it, causing you to be unable to physically aid yourself. Asthma. So a person in your family might be asthmatic. Speak to your grandmother, speak to your mother if their great grandma is alive, if your great grandfather, if your grandfather, anybody in your family that is an elderly that might have information that you did not get, right? Just go to them, talk to them, and say, Grandma, grandfather, mommy, did anybody in your family have asthma? Hear what they have to say. If they're asthmatic now or they were asthmatic in your family, be on the lookout for it. Read up and find out some things that trigger asthma. You will not be able to protect yourself from every single thing, but at least try to an extent to protect yourself from, putting yourself in harm's way of triggering what might be pre-existing. If you have person in your family that have heart problem, heart condition, heart diseases, you need to do your proper checks. You need to monitor the amount of fluid that you're intaking. You need to be checking on your blood. Just follow up with the doctor, right? So when you know of these conditions, you know that you need to do follow-up, and it's very important, because what I find as a nurse is that many individuals were not basically privy to information from their elderly or from other family members of things that were going on in their family, of disease conditions that existed in their family. And when they come to the hospital and you said, your blood pressure is high, their blood sugar is high, and you say, are you a diabetic individual? No, nurse, I am not diabetic. Is anybody in your family diabetic? They'll tell you, me no know, I know. And then when maybe a family member comes and visit them, and they give you the go ahead to be able to speak to this family member about what is going on, and you query from this family member might say, yeah man, my grandmother did have diabetes and my mother did have diabetes, and they start to tell you every single where this condition had existed, or every family member that had this condition previously, that maybe had died from it or maybe still suffering from same. And if the person that is in the hospital now was aware, maybe there's a chance that they could now, take all precautionary measures as necessary to prevent themselves from being there. So guys, speak to your family members, talk to them about things. Grandma, was there anybody in my family that had blood pressure, diabetes, and all the above that I mentioned before? And when you know this, you'll know how to better protect yourself from becoming greatly affected by it. That does not mean it will not affect you, but at least you'll be monitoring yourself, you'll be following up at the doctor, you'll be doing all of that can prevent it from becoming chronic, that can prevent this disease from damaging your kidney, from damaging your liver, and from even causing you your life. You understand? So do what you have to do. Check your body, follow up with your doctor, do regular check with your family members, talk to them, sit down and have constructive conversations with them so you can know what is going on and how best to monitor yourself and monitor them too. Thank you for watching. Remember to like, share, and subscribe to my channel. Thank you guys.